Doctors, have you ever discovered a dark secret about a patient that changed everything? It was a typical evening when the emergency call came. I was sitting down to dinner when suddenly my phone rang with an urgent case. A pregnant woman over 4 months along had fallen down the stairs and was now experiencing severe abdominal pain and bleeding. Without hesitation, I dropped my fork, grabbed my coat, and rushed to the hospital. When I arrived, the chaos of the emergency department matched the urgency I felt. A nurse was already wheeling the pale and moaning woman into the ER. She looked to be in extreme distress, crying out in pain with each movement. Accompanying her were 2 anxious family members, a man and a woman in their 40s. The man seemed especially distraught and I guessed he must be the woman's husband. I instructed the family to carry the pregnant woman on the examination bed and asked briefly about her medical history. "How long have you been pregnant?" "More than 4 months." "How did this happen?" "She accidentally fell down the stairs." "When did this happen?" 4 o'clock this afternoon." I quickly check if there is anything wrong with the fetus. However, the scene on the screen surprised me. The fetus had no heartbeat. Moreover, the structure of the skull, chest, and abdomen is very disordered, as if it has been broken. I observed the pregnant woman. The pregnant woman's belly was smooth and white, and there was no trauma to her whole body. Why was the fetus fragmented? I asked the pregnant woman suspiciously, "Could you still feel the fetal movement before falling down the stairs?" The pregnant woman groaned in pain and said, "There are still some this morning." I hesitated for a moment and told her, "It's impossible. The fetus has been dead for a while. Before you fell down the stairs, the fetus was dead." The pregnant woman and their family were a little surprised when they heard these words, but they were more nervous. I then asked, "How high are the stairs in your house? How did you fall?" The 2 family members rushed to answer almost at the same time. "She rolled down 2 floors. She fell over 3 meters." I glared at them strangely, just to see the 2 family members secretly exchanging glances, looking very guilty. I want to ask about the medical history further, but I found that the moan of the pregnant woman gradually turned into a heart-piercing scream. I immediately called the director to come for an emergency consultation. After more careful observation, he came to the conclusion, the fetus is located below the interruption of the anterior muscle layer, and it is very likely that the uterus is ruptured. After listening to the director's judgment, I was still confused. This patient claimed to have suffered a fall, but there was no trauma on her body at all. It would certainly not have been a fall from 2 floors, even if it was a real fall. It's not heavy, and it won't break into a uterine rupture anyway. Finally, because the uterine tear is too large. The arteries and veins on the right side of the uterus have been severed, only subtotal uterine resection and partial cervical resection can be done. After watching the operation, I happened to bump into the female family member who was guarding outside. She hurriedly stopped me and asked about the situation. I glared at her. If the pregnant woman came to the hospital 1 minute later, her life would have been lost. The face of the female family member turned from white to blue immediately, and she walked downstairs without asking anything. 2 days later, the mother passed the dangerous period. Under repeated questioning by the obstetrician, the patient vowed to tell the truth. It turned out that she had already given birth to 2 girls. At about 20 weeks of her pregnancy, she went to a so-called hospital in the advertisement for a B ultrasound. The doctor there said that the baby was still a girl, so the pregnant woman decided to have an abortion. 2 days ago, she took the medicine and went home. The fetal movement disappeared after taking the medicine. The next morning she started to have abdominal pain. So she went back to the hospital to induce labor. A self-proclaimed gynecologist received her and performed the procedure. After some rough operations, the labor could not be induced smoothly. In the end, even the fetus was cut into pieces with pliers and scissors, but the fetus was not taken out. Luckily, the pregnant woman survived.